Who is responsible for that? It is, you know, it can't, everything seems to be blamed on the government per se at the moment. To a certain degree, I agree with the lady that whose text or email you just read out about, you know, care homes. You know, they are the ones you pay a lot of money to be in if you have someone in a care home.
Yeah, you certainly do. Tell me about it.
You know, £1,000 a week is,
my dad was in there for years.
Can be, you know, quite reasonable compared to some. But you have this problem with hospitals because, again, Ian, there is no provision.
In 300 yards, keep left to continue on Fags Road.
They get the proper care they need in hospitals. The old phrase comes back. It's been pushed away, but it still applies today.
Listen, Judy.
And that is bed blockers.
Oh, God. Listen, I'm glad for your input.
Keep left to continue on Fags Road.
Judy in Essex with her views on this. Just some breaking news from our newsroom, actually. The infection rate in Bolton.
In a quarter of a mile, turn left onto Great South West Road, A30.
Certainly has risen from 126.2 per 100,000 to 192 per 100,000. It doesn't sound a lot, but it is. So yeah, we're in the middle of this now, and this is only going to get worse. And if those figures are to be believed, and why wouldn't we, about what is happening in care homes, the kind of what did we have? We had a sort of guarded response to the last figures and the fact that things were rising, because we were kept secure by the fact that most people who are getting newly infected were of a younger age and therefore less likely, not impossible, but less likely to need hospitalisation or indeed die. However, once you start hearing figures like this, that it was last Friday, wasn't made public, that it was only sent to care homes, that so many residents are now at risk, you begin to think that maybe we're not so secure as we were. So let me give you another bit of information about Bolton. Bolton has seen another sharp rise in infections, 192 cases per 100,000 people. That's a substantial rise from, when was this? 7 days to 3rd of September, end of August, beginning of September. So about a week ago, 126.2 cases it was. It's now 192 cases, new cases per 100,000 figure. That figure, it was already the highest rate in England, and now it's...
Take the second left onto Great South West Road, A30.
Helen. Hi, Helen.
Yes, good evening.
Good evening.
Yes, well, I know about care homes because my late husband was in a care home, and I'm glad.
Continue on Great South West Road for 3/4 of a mile.
Not alive today. Because, first of all, you couldn't understand, or you wouldn't understand why I couldn't go and see him. I still go back to the care home. Going back to the issue of visitors and all the rest of it, where I'm allowed to go in for reception, but no further. That is it. When it comes to visiting two of the people that I got to know, not allowed, full stop. It's only one relative, once a week, who's allowed to go and visit that person, which is their relative. Strictly not allowed, full stop. You cannot get past reception. End of story.
But this, it sounds like the right...
In a quarter of a mile, take the exit towards Heathrow Airport.
No, this particular surgery from this particular care home, they've had no infections at all, and neither have the staff.
What are they?
Whatsoever.
What do you think they're doing right and others are doing wrong? What you said before.
The staff know what.
Take the exit towards Heathrow Airport.
And of course, wear your masks, wear do this, do that, and do the other. As long as they do not have visitors from the outside world.
In a quarter of a mile, keep left at the fork to continue towards Southern Perimeter Road.
It's actually their responsibility to make sure their residents are safe, not
I do, and this care home in particular, they have been desperately restrictive, said no, that is it, you do not get past that door, end of story.
And you don't think that other care homes are quite so strict? Don't know.
Well, no, I do know, but anyway, no, they're not strict.
I agree with you.
That's all I'm going to say.
All right, Helen, thank you very much indeed for your call.
Keep left at the fork.
Well, I enjoy you listening to my...
Thank you.
Thank you, Helen.
Thanks, bye.
Bye-bye. 03456060973. Yeah, my dad was in a care home for several years. It is not cheap. And you have to find a good one as well, because not all of them, they do vary, to be honest with you. Don't think that there's a sort of quality line that they all have to attain. They don't.
In a quarter of a mile, at the roundabout, take the second exit and stay on Southern Perimeter Road.
For people to, it's the care home providers. If you work for a care home provider, if you're a member of staff, do you think it's your responsibility to provide PPE, to provide enough social distancing, the gloves, visits still not allowed? I think this will come down hard on visitors to care homes. I think they're going to find a lot more restrictions now on visiting elderly relatives. How do you feel about that? Is your elderly relative a bit confused by everything that's going on? 03456060973. As I say, my dad was in a care home for the last few years of his life, and he wouldn't have known, to be honest, if we were visiting him or not. I don't think. It didn't feel like he recognised me or anyone in the family.
Exit the roundabout onto Southern Perimeter Road.
Whether or not you
Continue on Southern Perimeter Road for 1.5 miles.
Whose responsibility is it? Maybe that's the question. Is it more the responsibility of the care home providers to look after people? But yeah, then again, you know, I'm amazed to hear that people, the most vulnerable people are the people who are over a certain age. There's no question about that, because their immune system is going to be much lower than the rest of us. They are susceptible to infection, and this thing can wreak havoc, and worse. So this idea that people aren't being tested, if they go to hospital for another unrelated reason, and then they come back into the care home, they're not tested before they return. And that's very, very dangerous. You could say that is almost culpable in some way, couldn't you? Tell me what you think. If you've got anyone in a care home, if you've got a relative who's in a care home, if you work in a care home, if you actually own a care home, if you are a care home provider, I'd like to hear from you. It sounds to me like this thing is back with a vengeance, or are we getting too ahead of ourselves? 03456060973. Ring now, you'll get through. It's 6:30. News headlines, Tim Humphrey.
The UK's chief Brexit negotiator says the government needs to hold powers in reserve to ensure the balance of peace in Northern Ireland isn't disrupted if the UK fails to secure a free trade deal with the EU. Proposed legislation going before the House of Commons tomorrow would breach international law if passed. The number of people in the UK who've tested positive for coronavirus has increased by more than 3,300. Official figures also show another 5 patients have died after testing positive for COVID-19 within the past 28 days. Bolton in Greater Manchester is now showing an infection rate of 192 people per 100,000 of the population. Everton have started the new Premier League season with a 1-0 win at Tottenham. Recently promoted West Brom suffered a 3-0 defeat to Leicester on their return to the top flight. Jamie Vardy scored 2 penalties for Leicester. And the weather cloudy with further outbreaks of rain tonight for northwest Scotland, dry with clear spells elsewhere and a few fog patches by dawn, mild with a low of 12.
This is LBC. Sweaty palms, shaky hands. Are you heading for a hypo? You should stop and check your glucose, but it will take time, and now is not a good time. Relax. Scan with the Freestyle Libre system, the smarter way to check your glucose with your phone. You can do it anytime, anywhere. No routine fingerprints, less hassle. Go to scantotest.co.uk to trial it with our money-back guarantee. Always read the user manual for important product aspects and limitations. Talk to your doctor for diabetes management. Terms and conditions apply. See website for details.
We all cough and sneeze occasionally. We can't change that. But
In a quarter of a mile, at the roundabout, take the first exit and stay on Southern Perimeter Road.
sneeze screens from WorkShield. Designed to click together in seconds, there's a WorkShield for every use in every business. From just £73 delivered. Order now and save an extra 10% on all products with code radio. WorkShield. Get your business going. Price excludes 20% VAT.
Exit the roundabout onto Southern Perimeter Road.
Yep, they just went online to Kazoo, picked out the car they love from thousands and
In 200 yards, at the roundabout, take the third exit onto Stanwell Moor Road, A3044.
big finish there. Cue the synth. Can you buy a used car in a smart new way? Kazoo, yeah you can. At Selco Builders Warehouse, we've got
of Trade quality building products. In September, we've got a 12-litre tub of Armstead Trade white contract matte emulsion for only £15.99 ex-VAT. Now that's a real deal. Find even more real deals at Selco Builders Warehouse and online at selcobw.com. Selco, serving the trade for 125 years. We've got it at Selco. Selco is where the trade goes. No charge to 20%.
At Big Motoring World, we usually say go big or go home. But now we're saying go big from your home.
Exit the roundabout onto Stanwell Moor Road.
Online and then collect in store. Contact-free digital signing, sanitized cars, and a whole lot of loving from 2 meters. Big Motoring Love has never been so clean. Order online at bigmotoringworld.co.uk.
Continue on Stanwell Moor Road for 1 mile. In a quarter of a mile, at the roundabout, take the second exit and stay on Stanwell Moor Road, A3044. Exit the roundabout onto Stanwell Moor Road. In a quarter of a mile, turn left onto Colnbrick Bypass A4. Turn left onto Colnbrick Bypass A4. Continue on A4 for 2 miles.
Treated there in May or being transferred to other London hospitals. good advice on protecting themselves if cases of the virus return to dangerous levels. This is in the Sunday Telegraph today. Letters containing specific advice for the recipient. Here we go. We've got another algorithm, another model, mathematical. Letters containing specific advice for the recipient will be targeted at individuals identified as a new risk model based on factors such as their underlying health conditions, age, sex, and weight. Initially, this reshielding program is due to operate in local areas experiencing sufficiently severe levels of infection. So I'll assume that if you live in Bolton and you're vulnerable and you've been shielding and you come out of shielding, you might be asked to reshield again. I can't say that for definite, but that's definitely what is being suggested here. A Whitehall source says if the rate is concerning across the whole of England, we are prepared to do it on a blanket basis, and it gets up to that sort of national advice. This is obviously amid rising concern that COVID-19 is increasingly circulating among the elderly. And a nationwide alert to care providers and councils on Friday night, this is what I was mentioning before, the Department of Health has urged bosses to take necessary action to prevent and limit outbreaks. So that's what we're asking. Let me read a few texts. We've got a pretty empty board at the moment, so if you ever want to speak on LBC, now's your time. 0345 6060973. There's two aspects to this. One is the government's letter on Friday to care home providers saying, you know, you should take specific precautions. They don't actually say anything apart from be alert, try and introduce your own measures that will stop this happening. 0345 6060973 is the number to ring. Let's have a look here. Good afternoon, Ian, says Maria. Hello, Maria. The people in care homes have always been the most vulnerable. This is not new. Sheila Fogarty's been pushing for open visiting on her show for weeks. Open visiting, what's that? If it was my relative and I was really concerned, I would look after them myself, says Maria. Huey says residents in care homes facing another long period of trauma. They really haven't recovered from the last dose of inhumanity. We are going to see thousands of more deaths in care homes as lessons have not been learned. Hopefully we've learned some lessons about all this, but this, you know, to hear from somebody anonymously that an elderly resident of their care home where they work has gone to hospital for an unrelated thing, and before they were allowed back into the care home, they weren't tested. It's just, I don't know. Ian, my neighbours have people in and out of their house all day long, kids and people in their 20s, 30s. The rule of six, get ready for the rule of six, it's happening tomorrow, is not going to happen. Lockdown meant nothing to them. Half the people that visit their house are in care worker uniforms. People like this all over Slough. I'm restocking the toilet rolls, says Nikki, in Slough. And this texter here saying, Ian, the reason for all this rise is because they allowed all the pubs and sit-in food places to open. The government encourages us all to get out there and mix. This is the end result. Okay, well, let me ask you that. In the dearth of calls at the moment, I want to ask you whether or not, why has this virus reappeared, in your opinion? It's a no-brainer, really, isn't it? Because, you know, they've eased the lockdown, people are meeting up in larger numbers, going back to university. I still think that going back to university students will be a breeding ground, to be honest. So, you know, who do you blame for the rise in COVID-19? Or maybe we shouldn't blame anyone. Maybe we all just need to be responsible. It's happened in every country, virtually. There's been a sort of second wave. I call it a second wave because we had it. But so far, we haven't seen the second wave alive and kicking in the elderly and the vulnerable. Now we are. The government has written to care home providers. They're actually saying, you know, we've seen a peak. We've actually got figures on this. They reckon 1,100 new cases every 24 hours in care homes. 43 different care homes being affected, according to this letter that was sent. The letter was from a man called Stuart Miller. He's the Director of Adult Social Care Delivery at the Department of Health. And he said in this letter to all these, as I say, 43 facilities, but he sent it out to all of them. He said, you already know that we're experiencing a rise in confirmed COVID-19 cases. I need to alert you to the first signs this rise is being reflected in care homes too. I thought they were going to be protected, but obviously it's now spreading there. And that's when this becomes serious again. Not young people. I know you probably think I'm not being careful enough, but it's true. You know, young people do get ill from it, but they don't necessarily have to need hospitalisation, do they?
In 200 yards, at Langley roundabout, take the second exit onto the M4 slip road to Maidenhead, Reading.
Letter sent to care homes on Friday has reported an increase in notifications of COVID-19 cases in care homes. Testing data has also shown an increase in the number of positive results. Currently, the infections are mainly affecting the workforce, but clearly there is a risk the virus will spread to care home residents or to other parts of the care sector. Unfortunately, in some care homes, with recent outbreaks, this does appear to have occurred, with residents